Okay. Go ahead and we'll get started. I wanted to start by first saying a big thank you to the Administration for Community Living and Catholic Charities Circle of Care for Dementia for sponsoring these and all the webinars that we've been able to have this year and last year as well, and posting all the recordings. It's really been such a gift to be able to connect during these times of being apart. And to Hale Kuike, we are also one of the sponsors of the webinar. So thank you to all the sponsors. We're going to get started here. So Jody mentioned the Positive Approach to Care. Positive Approach to Care is a national or international organization that works to help change and improve the lives of people who are living with dementia and their care partners. And it starts with these philosophy points. And what you see here is what we use in all the training programs. And we also use the Positive Approach to Care training program at Hale Kuike for all staff and volunteers as well. So we're very happy to share this with you. We are a Positive Approach to Care designated organization as well. You will see there's a new survey up. Today's webinar is about the holidays, and you can scroll up and down. There's 3 multiple choice questions asking about what are your favorite things about Thanksgiving, what are your favorite things about Christmas, and then also about New Year's. So kind of I want everyone to start thinking for yourself, well, which are the things that are the most meaningful and most important for you during the holidays. And we will be coming back to this to look at it together so we can think about those things as we move towards the holidays. I'm very excited to be doing this webinar a little earlier than I have done it in the past. I think in past I've done it both in person and as a webinar, but not till December. So that's a little later where we missed Thanksgiving, but Thanksgiving is a big one too. So I want to start by having us all, the year is just speeding by, and it's like already, I'm finding myself like, oh my God, I can't believe it's November already. And so this time of the year, November, December, January, it's boom, 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 all the holidays, one right after the other, Thanksgiving, Christmas, New Year's, and there are so many things that are involved in those 3 major holidays. There are other holidays as well for other different cultural practices, religious practices, and so many of us might have ones in addition to those 3 big ones that we all see advertised everywhere. But so we're going to take a step back today. We're going to be taking a deep breath all together, because the holidays are stressful. Caregiving can be so stressful too. So we're going to look at how these 2 things come together at this time of the year and what we can do to help support ourselves and the people that we love that we're caring for throughout this time of the year. And to put all that on top of it, we are still living with COVID-19 and the pandemic. So things have changed some since last year when we did the same webinar, but some things are the same. So we'll examine that. Many of us might not be able to be physically together this year, whether it's because we're separated or there might be some other pandemic related reason that we're needing to be apart. How can we get connected even when we're apart? Gift giving. Yeah, it can be a big part of it, but how do things change when someone is living with dementia around gifts? And for you, gift-wise as a care partner. And how can we have, that's an acronym we'll be looking at, peace, more peace for the holidays, more peace, more joy, less stress. And lastly, but not the least important thing, it's only last in terms of where it comes up in this webinar. Number 1, caring for you, the care partner, the caregiver, the professional, the medical professional, long-term care support person. How do we care for you during this time too? So that's what we're going to be taking a look at today. I want to start by taking a look at what are the stresses that we see go for ourselves during the holidays. They're a joyful time of the year, but there's just so much going on. There's a lot of commitments. And this year, last year, November, December, we were in a different stage of the pandemic, pre-vaccine, a lot more lockdown. For us at Halikuike, we were completely locked down. Families could not come into the building to have in-person visits for a full year, and that included all of the holidays last year. So things have improved, but that doesn't mean that it's still not stressful. So we're all still navigating this time with those we care for and love with people with dementia. So we are able to get back together. And so that can be stressful too. It's new. What do we do? What's safe? What's not safe? Which traditions can we do or not do or manage? And so keeping that in mind, our personal health and mental health needs, holidays, things, how we want to observe it. Many of you checked off a lot of different things on that survey. Where is the person we're caring for who's living with dementia at this point in time? What are their needs? What kind of things can they, how will they be able to engage with the things that we'd like to do during the holiday? So we want to take a look at all those things and not leave any of them behind. COVID-19. We are moving, as I know many articles have been talking about, moving from pandemic to endemic. We are still in the pandemic stage. It will eventually get to endemic. We'll be living with it like we live with all things, but all other viruses. But right now, we are just now starting to open back up here in Hawaii to a lot of full capacity things. Our Hawaii COVID-19 vaccination rates are some of the highest in the nation. So in a lot of ways, we are doing really well. But there are still many, many challenges, especially for our seniors and people who are living with dementia with regard to the immune system. So people who are older and also who are living with dementia are immunocompromised. So I'm starting out with my immune system not able to mount as robust an immune response, even to everyday things like UTIs or other infections. And same with vaccines. So whether it's a flu vaccine or the COVID-19 vaccine, my body is not able to raise my immune level to the level that it would be in a younger person, let's say. So that's why boosters are important, or even with the flu vaccine, the dosage that they give to, there's a separate version of the flu vaccine for older adults that's a little stronger because to compensate for that immunocompromised state. So when we're looking at it now, and as we all know, as we move through this pandemic, things are changing, and part of the things that changes, and it's for the good, is that we learn more as we go through this. This is our first time going through COVID-19, this particular virus. And so as time goes on, things change. It may, sometimes for the better, sometimes for the worse, but about breakthrough cases, there's a lot in the news about breakthrough cases, and they do happen for fully vaccinated people. Seniors, this group of people that we love and are caring for, are at a higher risk for breakthrough cases because their immune response is not as good than younger adults. And that with the breakthrough cases, they're at a higher risk for severe illness, hospitalization, and death because of a breakthrough case. And that doesn't, it's not because the vaccines are not good or they're not working. They do still make a huge difference, but it's just because of where they are in their life journey. They're because of their age and because of the changes which come from dementia, the changes in the brain, the progressive degenerative diseases cause dementia, Alzheimer's disease, strokes, Parkinson's. The brain is just not able, the brain controls your immune system response, is not able to mount that. So it's just a fact that we have to keep in mind as we move forward during this pandemic. So it is still, there are still many cases of COVID-19 out there. There are still many people who are unvaccinated for different reasons, whether it's by choice or by age eligibility, or perhaps some people have medical reasons they're not able to get it as well. But we need to keep things in mind when we're going back out. We are thankfully able to get back together this year in a way we were not last year. But the safest option is still to limit it to small in-person visits to small vaccinated groups inside your household. It is possible to have interactions safely for the senior with someone who is unvaccinated, provided the distancing precautions are taken, masking and outdoor distancing. But it does take more thought. There is still a risk. So free, like okay, let's take grandma out to the restaurant indoors. All take off our mask and enjoy a full capacity meal at a full capacity restaurant. I'm going to make a little timeout symbol. Even there's things I would say even aside from COVID-19 that would make that hard or a challenge for someone living with dementia. But let's take it slow. We're growing our circle. We want to still be careful. We don't want to have another spike like we had back after 4th of July here. So how we celebrate will be different this year, but it has improved, and we definitely can share love and joy with each other throughout this holiday season. So I want to talk about some things that can be very stressful and we feel bound by. And well, the first one is by past traditions. In some ways this year talking about this topic is a little different because last year kind of broke tradition. There were so many things we were not able to do last year in any way, shape, or form around our holiday traditions. But so this year might feel like a full opportunity. We're going to look at what you've entered in, you chose for yourself for what's important, but I wanted to try and have you take a little step back and try not to rush back into doing it all exactly the same way you did it before the pandemic. It's okay to make changes and even to skip some holiday traditions. There is still a lot of stressors going on. You in no way should expect yourself or other people to place expectations on you, especially during a pandemic, because as a caregiver, you already have your plate full caring for yourself and your loved one. So one way to help navigate this is to discuss it in advance, what you would like to do, what you're able to do. You want to make sure, and what precautions you want or need to take, just so everybody can be on the same page ahead of the holidays. And I kind of started thinking about this even before the pandemic, but consider the holidays not just a single day. It's not just Thanksgiving Day or Christmas Day or New Year's Day. Thanksgiving and the sentiments and the love and the sharing that we want to do at Thanksgiving can be a different day. It can be more than one day. There's no reason it can't be every day in some senses, but kind of free yourself of having to be bound by that single day. Like, oh, we all have to come together on Christmas Day, or we all have to, it's okay to spread it out and kind of spread out the stress as well. If there's a lot of pressure on a single day, things, for someone who is living with dementia, it might just happen that day is just not a good day. I'm just not having a good day that day. Some other challenges may have come up that make it really hard. So if we keep it simple and spread it out, spread the joy out throughout the month is what I would say. To keep things really, really manageable and fun. I mean, that's the whole thing about all of these holidays is we want to enjoy the pleasure of each other's company and all the things that go along with it. So if the stress of it is taking the fun out of it, that's a time to pause, take a little time out. It's like, okay, this is stressing me out. Can I just let this go or make some change that is not, so it can still be great, but it's different, and that's okay. Everything in moderation. So there are so many temptations and wonderful temptations throughout the holidays here. Thanksgiving is marked by a ton of food. Christmas is marked by a lot of sweets. New Year's is marked by a lot of alcohol. So enjoy, but don't overindulge. And I say that to you as a caregiver, a care partner, for your own health and well-being, because it's a long season. You also want to be prepared for unexpected things. Things are going to come up that, like I mentioned, like I'm the person you're caring for. And, Thanksgiving Day, I don't want any people in this house. Everybody out, right? Be flexible. If you can't change it, let it go. Relax and move on. It's okay. And you have to remember to laugh a lot, because it's not only is it a coping tool, but it allows you to laugh at yourself too, and to put things in perspective. Laughter is really amazing. So we do still have, I put a link here to the Hawaii guidelines. They are changing. So for the sake of this recording, I'm not gonna repeat what this moment in time's gathering limits are, but please keep up with what the limits are, and stay safe during this holiday season. I want to share this little short video that's going to appear in this black box here, which is about Thanksgiving. I met a woman and her husband. The woman was a care partner for her husband, and she told me that, my husband, he doesn't say much. He's living with dementia. He pretty much has no expression, doesn't show any emotion, very flat affect. And I can't get him excited about anything anymore. But when I show him this video, this Thanksgiving video, he just bursts into laughter every single time. So I'm going to show you this little short video. Okay, here we go. Okay, I don't get any kickback from Jenny O'Turkey, but a couple of things about that video. One is it's all visual humor, slapstick humor, and that is a way to communicate and connect when language is not working so well anymore. And so if you find something like this, and I'll send Jody a link to this, okay, you can be included in the email to you afterwards. And it connects and makes somebody laugh around the holidays, but you use it, play it over and over again. It still makes me laugh each time. The other thing is the whole idea of a pre-made turkey. I definitely am one of those people that I would take the whole week off and spend planning and prepping and doing Thanksgiving. I just love to cook and do all that. But sometimes it's best, to not, someone might say, did you make this turkey? You can say, no, I didn't make it, but I made it possible. And that is just as wonderful as having made it. So there are things like this kind of a pre-made meals. There's a lot of restaurants and things that are be coming up having with their pre-made Thanksgiving. So even if you can't cook all the same things that you did, you don't have the time, it's too stressful, it's okay to do something like this. So, oops, let me go forward. Some of us will still have a lot of physical distance. I know that we might be separated by miles. There might be a reason that you can't meet in person, face to face, but there are still ways to be connected. This was especially true last year, but it still is true for many today. You can drop things off outdoors. We're lucky we live in Hawaii with we almost always have outdoor options. It really can make a huge difference and really lower the risk. Video conferencing, this is something that I never would have thought would have been great before the pandemic. And it's not perfect for everyone, but it is a way that can really work to stay connected even when you can't be together. There are some things you need to keep in mind for it, such as crosstalk can be challenging if many of you are on the Zoom. having someone beside the person that who's living with dementia, like at Holly Creek, having a staff member with them to help support the call, because it is technology. We all have problem with that sometimes. The other is having a recorded message, music, recording of all of you singing a Christmas carol or doing a dance or something can be played over and over again, kind of like that turkey video. It really does. It really is meaningful. And I even have had a family tell me that this was during the height of the pandemic when we were locked down and couldn't get together, that their loved one, they were on a Zoom call with them. And at a certain point, the mother said, "Oh, can I get you anything let me get you something to eat before you go." And then at that moment, they realized, oh, she feels like we're really there, even though it's clear, she's on a laptop, but for her, this person who's living with dementia, she was really connected with them. And for her, it was as real in that moment. And she wanted to do that she had the social graces to want to do that. So I wouldn't underestimate it. Of course, getting together and being able to hug is the best, but keep this one in mind too, so if you are celebrating the holiday on a different day, let's say not Christmas Day, visiting mom, the week before, doing a celebration week before, and you're not able to be there on actual Christmas Day, this might be an option to keep in mind. For gift giving, this is a question that I get a lot at Holly Kwiki about what kind of things can I give, and should we wait till Christmas Day to do it? So there's a lot of different things. There's a lot of things we used to do with gift giving, things we know mom always liked this particular kind of book or this particular scent of candle or, things like that. But I would kind of take a step back and try and look at the person that you're caring for, where they are at this moment in the journey, and what kind of things do they enjoy with their senses in this moment, this 5 senses. What do they like to look at? What do they like, kind of things do they like to hear? What do they like to feel, taste, smell? So in the moment, that's one thing about, I would say it was one of the great lessons about sharing my life with my own family members living with dementia and our residents at Holly Kwike is really looking at life as in the moment. What in the moment can we enjoy together? Because it's all about the now. And so thinking about it in terms of that, the sense, tastes, things that really make the now, as opposed to the past or the future, is a really way to kind of look at what to provide. So this Buck and Buck, again, this is just a company that I know we've gotten a lot of things from at Holly Kwike. There are many adaptive clothing or devices available online, but that's one that I know has a wide variety. Don't forget yourself. It's easy. We professionals and personal family caregivers, we give. We want to make the holidays great for everyone, for the person living with dementia, but we don't take ourselves into account very often, and we don't give ourselves presents. So if anybody asks you what you would want, don't wave them off. Really, don't be afraid to say yes to a gift. I would like to pay the kid, pay someone to come and mow my lawn, or I would like, help, I can't cook dinner every night, food delivery would be good, a gift certificate would be good. Really include yourself. You are as important, and your physical and mental health is as important as the person that you're caring for. So you're a team, you're together. One can't do it without the other. So really do keep that in mind. These are a couple pictures of, one is pre-pandemic, you can see on the left from Holly Kwike, resident and family member together, and the other is during the pandemic through a window visit here. I wanted to include these two because this is more looks like a home setting without masking and things now. And this, there are still some circumstances when people are not able to come in. You see in this photo, there's a very young child, and right now at Holly Kwike, children that are too young to be tested, they're too young to be vaccinated, too young to wear a mask and be tested, the antigen tested for COVID, are still not able to come in and visit. So we are still separated, can be in that way, but where we can still be present together. During one of the window visits last year, I remember I was sitting with a woman who, our resident, and having a wonderful window visit with her son. And he asked a question to her, this was right before the holidays, which many, many families ask. So, Mom, what do you want for Christmas? Tell me, what can I get you? And she didn't miss a beat. She said, really loud, she said, you, I want you. He said, oh, no, Mom, what do you want? What can I, And I just had that moment. It was such I thought, yeah, that's, she pretty much summed it up. Your presence is the best present. When I was talking about the here and the now and the senses, you're part of that, seeing you, hearing your voice, touching, holding your hand. That is Thanksgiving, Christmas and New Year's all together. So of course, it's wonderful to get a present, something that you can open, something that, beautiful flowers to look at, my favorite kind of manju that I love to eat, things like that. But it's your presence that's going to make all the difference. It's the very best gift of all. And again, like I said, it can be given any day, not just on those days. This here is, there's that acronym I was letting you know about. This is by another person from associated with Positive Approach to Care, Melanie Bunn, of the Dementia Alliance of North Carolina. And I really like this acronym, Peace for the Holidays, being able to prioritize which ones are the most meaningful, important, empathize, viewing things through the eyes of the person living with dementia. And that's something that we do, we emphasize with all of the Positive Approach to Care workshops. And if you want to look back at some of the recordings, trying to figure out what's different. So, I used to love to go to this big crowded restaurant for a Thanksgiving meal. And now it's too overwhelming, too many sounds, too many people. I just can't handle it. So recognizing what the changes are and trying to see that there, making adjustments, reminiscing together. For many people who are living with dementia, longer term memories are still intact. I can still talk about how I used to cook this certain dish, or what I used to like to eat, or what my mother used to, the mango tree that was in my yard, or the fig tree I used to sit in as a kid at the neighbor's house. That's true. You can talk to me about that when I'm older. And enjoy making memories. It's not like it was, but it can still be some magical moments for sure. This is another handout. This one is one that was put together by Teepa Snow and the Positive Approach to Care team. And I like that this one is divided into three parts. So looking at it from the perspective of someone who is living with dementia, from the perspective of there's a lot of overlap, the care partner, and also for visitors. And so this visitors, you might be getting together with some family members or friends that you haven't seen in a while, and who haven't seen your loved one who's living with dementia in a while. It's good to start having a conversation before people come in about just tips about how to interact, letting them know that there have been some changes. Mom's not quite as stable on her feet anymore. She's repeating herself more. It's okay. Just go with whatever she's saying, to reminisce. One big one that I always advise visitors is no, don't quiz them. This is not a quiz. Holidays are not a quiz show. Hey, remember me? What's my name? Which one am I? I know when I meet people and I can't remember their name, a little panic attack comes on, and it makes it harder for me to remember someone's name. So let's cut everybody a break and introduce yourself. Even if they should know you, or you wish they were able to find your name, that's what we're carrying inside. But for the person, hey, Mom, it's me, Dorothy. Oh, of course I know. Oh, yeah, yeah, you do. But yeah, so introduce yourself, prompt people to introduce themselves when they come. And if they don't, introduce them. Hey, it's your husband, Alex. Oh, yeah, Alex. So that can go a long way just to get started on a friendly note. Quiz show is this. Introductions is getting connected, right? Nobody wants to feel stupid or put on the spot. So you will be getting, if you haven't already, this couple handouts related to the one I just showed you earlier from Positive Approach to Care. This one from it's a two-sided one piece from the Dementia Alliance of North Carolina with a little more detail about each of these piece acronyms. And also this side here, it has some of the things that we went over already. And again, it's so interesting to look at these with the perspective of the pandemic, because these were put together before the pandemic, but they really apply, especially now. And they also apply not just to for the person who we're caring for, but for ourselves too. We want to continue our exercise routine or start one during the holidays. We want to make sure that we have a break. So this little blue square here is so important. When I talked about just on the other slide about presence, giving yourself of the regular present of a little time away, a little distance, because caregiving, it's really close and intimate, and it's especially home caregiving, it can be all day. No one person can do all the caregiving by themselves for the whole journey of dementia. It's really a marathon. You need to build a team and come together and have support for you as much as for the person that you're caring for. So starting small to find a way to have a little daily break, a half an hour or less, 10 minutes. Sometimes I even say, and I've done it for myself, 10 minutes alone in the bathroom. Just, that's one place that people don't tend to barge in on you, to just take a little break, do some breathing. You know, this one says a half an hour. It may even seem daunting to think about having a half an hour to yourself. So start small, bite-sized pieces that you can do. So I'd like you to take a moment here. If you have get a little pen and paper, if you have one sitting there, or you can type it on your phone. If you have what one small break can you build into your day today? You know, I know we're talking about the holidays, but the holiday season starts now. What one small thing can you do for yourself today to take a little break? Take a short walk in the garden, do a little breathing, do a little reading, anything, something that can have you be able to step away for a moment. And then moving on to weekly, you know, being able to get away for a little bit of and then monthly, and then also yearly. Those are bigger asks, I know. So start with the daily, build a team, and it might not be your family. Sometimes it is, sometimes it isn't, who can come in and be with the person living with dementia that you're caring for. So you can be away for a little bit, for a couple hours, to go to the library, to get that new book, to just have a nice, you know, cup of coffee out, you know, out of the house for a little bit. You know, it's starting to build your team early. If you're earlier in the journey of dementia, the earlier you can start building and adding to your team, the better. But it's really, really so important for your health and your mental health as well, because caregiver burnout is a real thing. And it does happen that caregivers' physical health and mental health is so profoundly affected that they're not able to continue caregiving, whether it's because of the really severe health issues. So really, I can't emphasize that enough. It'll make a huge difference. Another thing about the holidays, caring for you during the holidays. we think of the holidays as happiness and light. You know, there's the marketing of it, the expectations of it, it's all positive. But it's not necessarily. Staying positive doesn't mean that you have to be happy that you'll feel happy all the time. And if you don't, there's nothing wrong with you. It's normal. The stresses, it's okay. Know that even though there are hard days, there are better ones coming. And it's no reflection on you as a person that you're not feeling the Christmas cheer all during Christmas. I really like this photo of the bridging of the two generations here, both through the window. This continuum of life from the early all the way through the end of our journey, where we're all connected together. So having, like I said, building that team and having someone be there with you, even during the hard times, you know, and holiday stress, holiday depression, it's a real thing. So getting help, including professional help, is really, really important. So I just want to do a little kind of look back over the poll that we did in the beginning. Maintaining all holiday traditions, the key that makes it false is all. You don't have to maintain them all. Each of our families is unique, and so there might be a huge mountain of expectations of what we're supposed to do for any particular holiday. Pick the ones that are most important to you, modify them as needed, and enjoy. Enjoy. You're not doing anything bad by leaving a few on the wayside. For example, I know many people write long holiday cards, including long summaries of what your family is doing at this time of the year. And if I could have if you think about how many of us love getting those cards and catching up, getting Christmas cards. So many, we love getting those cards. How many of us love writing them and but feel the pressure, and it's just can be a lot. I've had so many years where I meant to write them and then didn't, and then felt bad about it. Oh, okay, Dorothy, take a time out. It's okay. I have a cousin, and I think this goes to the second one, holidays need to be observed on their date on the calendar, false, who had this genius idea years ago, and I didn't realize the genius of it until relatively recently. She doesn't send out that kind of Christmas card and Christmas family newsletter in a sense. She sends it at Valentine's. It's the only one I get at Valentine's. It's a lot like the ones I get at Christmas, but it stands out, it stands alone, and it's still that sharing of the love. It's just at a different time of the year. So yeah, so the flexibility, if you're not able to do it during this 3-month holiday period, it's okay to even be later in the year. You know, stick that Christmas card on Chinese New Year instead. It doesn't have to be. About a lot of gifts. So the key on this one, default, is a lot. If you remember when you're young and little kids, if they have a lot of presents, it's like too much Christmas. It becomes very overwhelming. Keep things simple. Keep it with the now, the sensory now. What can we enjoy together right now? And remember, you are the best present for Christmas, being together. Doesn't have to be a lot of things. Doesn't have to be fancy or expensive things. It's this moment in time now. Even if the person you love doesn't remember it later, you talk to them the next day and they don't remember that you had come. That doesn't make it any less real. It's still as valuable as it's still the greatest gift of all. Is it safe for adults over 65 and over who are fully vaccinated for COVID-19 to socialize without restriction? We still need to be careful. We can socialize more for sure, but we still really, really need to be careful. It's not wide open for older adults. And staying positive during the holidays means feeling happy all the time. No, It doesn't. And it's okay. It's okay. So a few other things for yourself. So now we're talking about you, about managing stress. Some of these things we mentioned a little before, about finding those moments, 10 minutes, 30 minutes, listen to music, go for a walk, things like that. But I want to emphasize the last one about stress and depression. And this is not just about the holidays, but caregiving. Seeing a professional doctor or a mental health professional doesn't mean there's something wrong with you. It's normal. Your brain, you see your body, a doctor about your body when things are not working the way you would like them to. Your brain is no different. I know for myself, working with a therapist during the pandemic, really helped a lot. It's an incredible amount of stress. And so please do not hesitate. There is no shame in seeing a mental health professional to help and support you and build, like I said, about building that care team. Some of it's family, friends, neighbors. Some of it could be medical and mental health professionals too. Don't hesitate. Seek help and support for yourself. So the next one I would like to take a look at is expectations for yourself. Give yourself. We talk a lot about understanding the perspective of the person living with dementia, how they take in data from the world, how we're going to make modifications, and we're giving them a lot of grace and space and understanding. It can be hard to do that for ourselves. We have these expectations of ourselves, a good daughter does this, a good husband does this, good wife does this, and we set the bar very high for ourselves. And sometimes we set bars high for others too, like I think my brother ought to do this, but for ourselves, we're a tough judge on ourselves. So I really want to emphasize, please be kind to yourself and give yourself the same grace and space that you give to the person that you love and that you're caring for. And don't hesitate to give yourself a timeout before you get to the end of your rope, before you're just done. Fine, Thanksgiving's off. I've had it. Plan ahead, talk ahead, take a deep breath. It's okay. You can set limits. It's okay to say no. It's okay to say no. I'm going to switch to the next one here. So here, I really like this quote about slowing down, the part about slowing down. That's also, I'd say, one of the lessons that I think has been for me in working with and loving people who are living with dementia is learning to slow down. And whether it's the speed that I walk, the pace that the pace of my speech, the pauses that I give people to wait for them to respond, all those things. It's not easy to slow down. We're even during the course of the pandemic, and especially now that we're coming out the other end, it's like go. Oh, I haven't done this in so long. I'm just going to do it all now. Pause. So I want to take a look. We have up the things that people love the most about. You can scroll through and see the results about Thanksgiving celebration. So number one is getting together. 93% family get-togethers. Christmas get-togethers. Number two is the food, of course. Also seeing friends and family we haven't seen in a while. That one's pretty high up too, right? So go ahead. And then for New Year's, cultural traditions, and again, seeing people. So that's our big priority. So of these things, think about the things that you picked which were your priority and which ones you didn't pick. So many people didn't pick that holiday card. And if you didn't pick it, but you still feel obliged to write them like you think you should, because you had done every year, then maybe take a moment and think, like, is that something that I could let go for just this year, or do it differently? Do it like my cousin at Valentine's or something like that. But the things that you have put as your particular priorities, focus there, slow down and think about how you can simplify it. We want to get together. I'm so glad we can get together at last after this long, long journey that we've all been through together during this pandemic. And it's the greatest gift after having been apart all of last holidays. So we want to make sure that make that the priority, and again, find people to help and support you in that particular goal. And then I want to take a look here. We have a lot of these tips are online. So I want to thank you so much for coming together to learn and examine kind of some things that we take for granted around the holidays. There is the Alzheimer's Association holiday tips that you can click on. Also, they have a 24/7 helpline, so that you can call that anytime from Hawaii too. The handout, the holiday stress and peace for the holidays is there. The link to Hale Kuike's website for the recordings for 2021 and also Catholic Charities 2020. And the Positive Push to Care website. There are many, at tipasnow.com, there are many resources out there. And sometimes I think even for me, it can be overwhelming to start looking at the lot of different resources. But for here at the holiday time, pick one that's the most important to you. Is it getting to talk to someone right now, as opposed to reading something? Maybe the helpline would be a place to start, or talking with your doctor, or talking with someone. Is it getting, looking at the gift catalog? That could be something that can focus your gift giving ideas, just something small for yourself. So again, with that paper and pencil where you wrote down what you were going to do for yourself today, think about where you want to go next in planning for your holidays, whether it's getting help for yourself or help or a specific part of the holiday planning. Jot down for yourself what you would like to try and do next.